You hear a doctor talking to a patient called Emily Johnson. You have 30 seconds to look at the notes.
Good morning. I'm Dr. Smith. How can I help you today?
Good morning, doctor. My name is Emily Johnson. I've been experiencing some troubling symptoms lately.
Nice to meet you, Emily. Please don't worry. Can you provide me with your age and any relevant medical history?
Sure. I'm 34 years old. I have no significant medical history, but I have mild seasonal allergies.
Thank you. Can you describe the symptoms you've been experiencing?
Over the past 2 weeks, I've been feeling unusually fatigued, even after a full night's sleep. I've also had some shortness of breath, occasional dizziness, and a persistent headache.
I see. Have you noticed any other symptoms such as changes in appetite, weight loss, or fever?
My appetite has decreased slightly, but I haven't noticed any significant weight loss or fever.
Have you experienced any chest pain, palpitations, or swelling in your legs or ankles?
No, I haven't had any chest pain or palpitations, and there's no noticeable swelling.
Are you currently taking any medications or supplements?
I'm only taking a daily multivitamin. No other medications or supplements.
Have you had any recent changes in your lifestyle, such as increased stress, changes in diet, or alterations in your exercise routine?
My job has been quite stressful lately, and I've been working longer hours. I haven't had much time for exercise, and my diet hasn't been very healthy.
Thank you for providing that information. Based on your symptoms and history, I'd like to conduct a physical examination to check your vital signs and listen to your heart and lungs. Is that okay with you?
Of course, doctor.
Your blood pressure and heart rate are slightly elevated, and your lungs sound clear. However, I'd like to perform some additional tests to rule out any underlying conditions.
What kind of tests will you be conducting?
I recommend a complete blood count to check for anemia or infection, thyroid function tests to rule out any thyroid issues, and an electrocardiogram to assess your heart's electrical activity. Depending on the results, we may also consider further imaging studies.
That sounds comprehensive. How soon will I get the results?
We should have the blood test and ECG results within a few days. If further imaging is required, we will schedule it accordingly and discuss the timeline.
Thank you, doctor. Is there anything I should do in the meantime?
In the meantime, try to manage your stress levels as best as you can. Ensure you're staying hydrated, eating balanced meals, and getting adequate rest. If your symptoms worsen or you experience any new symptoms, please contact us immediately.
I will. Thank you for your help, Dr. Smith.
You're welcome, Emily. We'll contact you once we have the test results, and we'll discuss the next steps then. Take care.
You hear a conversation between a doctor and patient called John Davis. You now have 30 seconds to look at the notes.
Good afternoon. I'm Dr. Lewis. What brings you in today?
Good afternoon, doctor. My name is John Davis. I've been having some issues with my stomach lately.
I'm sorry to hear that, John. Can you tell me your age and any relevant medical history?
I'm 45 years old. I have a history of acid reflux and high blood pressure.
Thank you. Could you describe the stomach issues you've been experiencing?
Sure. For the past month, I've had frequent stomach pain and bloating, especially after meals. I've also noticed a loss of appetite and occasional nausea.
Okay. Have you noticed any other symptoms such as weight loss, changes in bowel habits, or fever?
Yes, I've lost about 5 pounds in the last month without trying. My bowel movements have become irregular, and I've had mild fevers a few times.
Are you currently taking any medications or supplements?
I take medication for my high blood pressure and an antacid for acid reflux. No supplements.
Have there been any recent changes in your lifestyle, such as increased stress, changes in diet, or new medications?
I've been under a lot of stress at work, and my diet has been inconsistent. I haven't started any new medications recently.
Thank you for the information. I'd like to conduct a physical examination to check your abdomen and vital signs. Is that okay?
Yes, of course.
Your abdomen is tender to touch, and your blood pressure is slightly elevated. I'd like to perform some additional tests to determine the cause of your symptoms.
What tests will you be conducting?
I recommend an abdominal ultrasound to check for any abnormalities, blood tests to assess for infection or inflammation, and a stool test to rule out any gastrointestinal infections. Depending on the results, we may also consider an endoscopy.
Question 25. You hear a doctor discussing a patient's condition with a nurse. Now read the question.
So Mr. Anderson was admitted early this morning for severe dehydration. He presented with nausea, vomiting, and diarrhea that started 2 days ago. He's a 45-year-old male with a history of hypertension managed with medication. His current medications include lisinopril and a diuretic. He's been on a clear liquid diet since admission and has no known allergies. He's moderately dehydrated, so we've started IV fluids. His blood pressure is on the lower side, but his heart rate is stable. He's responding well to the IV fluids, and his urine output is improving. He's a bit weak and dizzy when he tries to stand, so we need to monitor him closely for any signs of orthostatic hypotension. I've also ordered electrolyte replacement to address his low potassium levels. He seems comfortable now, but we need to keep a close eye on his fluid intake and output.
Question 26. You hear a hospital administrator briefing the nursing staff. Now read the question.
Good morning, everyone. I want to address the issue of patient discharge procedures. We've noticed an increase in the number of readmissions within 30 days, and it's crucial we address this. One of the main reasons for this seems to be insufficient discharge planning. Many patients are not fully aware of their post-discharge instructions, especially regarding medication and follow-up appointments. To combat this, we must ensure that every patient receives a thorough briefing before they leave, including written instructions. Another point of concern is the lack of communication between the hospital and primary care providers. We need to ensure that all relevant information is shared promptly. Lastly, let's be vigilant about ensuring patients understand their prescribed medications to prevent any confusion or errors.
Question 27. You hear part of a consultation between a nurse and a patient in a clinic. Now read the question.
Good morning, Mr. Johnson. I see you're here for a follow-up on your diabetes management. How have things been going?
Morning. Well, it's been a bit challenging, to be honest. My blood sugar levels have been fluctuating a lot.
I see. Have you been sticking to the diet plan we discussed last time?
I've tried, but it's not always easy, especially with my work schedule. Sometimes I miss meals or end up eating fast food.
That can definitely make managing your blood sugar more difficult. What about your medications? Have you been taking them regularly?
Yes, I've been good with that. I take them every day as prescribed.
That's good to hear. We might need to adjust your diet plan to better fit your schedule. Also, we can look into setting up a meeting with a dietitian who can help you with meal planning.
That would be helpful. I've been feeling a bit overwhelmed with all the changes I need to make.
I understand. Let's also check your blood sugar levels now, and we'll discuss any necessary adjustments to your medication if needed.
Question 28. You hear a chiropractor briefing a colleague about a patient called Ryan. Now read the question.
Today we're going to start with Ryan. He's 2 weeks post-surgery for a torn rotator cuff. He also had a spur on his acromion process removed. This is his first time in rehab post-surgery, I believe.
That's correct.
Okay, so today we're going to begin utilizing high-frequency vibration to break up the scar tissue forming in his left shoulder joint following the surgery. We're going to do each of his treatments that way, so you'll see a progression over time, how we get him back to a point where he's able to live his normal life. Movement's the key to rehabilitation, and this treatment resonates with the nerves too, so it should eventually help them heal quicker and reduce his discomfort.
Question 29. You hear a surgeon talking to a group of medical students about patient risk in emergency surgery. Now read the question.
If you look at the risks of elective surgery, they're really very low compared to emergencies. Clearly, then, we can make the biggest difference in reducing risk and improving outcomes in emergency surgery. Our mortality outcomes here are actually below average. We're at 8% compared to around 13% nationally. The emergency patients I handle tend to be older, so they're at higher risk. And when they come in, we haven't got long to prepare them in order to reduce any risks, maybe an hour or two. In terms of patient safety, every minute, every half hour we can use to get them ready counts. That's because the patients we're thinking about are prone to developing post-operative complications, given that they have a range of associated heart, kidney, and lung problems.
Question 30. You hear a surgeon talking to a patient who's just had a knee operation. Now read the question.
How are you feeling, Mr. Shaw?
Oh, exhausted. But the painkillers must be working. I can't feel my knee as you predicted.
You're bound to feel weary after an operation. It went well, though. We cleaned out loose cartilage from the joint. You can go home now.
Oh, thanks. I had an arthroscopy on the other knee several years ago, so I know what it's like. The idea that it gets done in less than a day is still pretty mind-boggling, though.
You'll need crutches for 2 weeks, but you should be walking okay within a month.
Oh, good.
Give it 4 months before you put any serious impact on it, though.
4 months? After my last stop, I started running again within a month. Thinking about it, though, I guess I paid for it. That knee had a lot of niggles for months afterwards.
Yeah, if your body's hurting, it's telling you something.
Okay.